I am Dr. Rita McGuire. I'm the Chief Medical Officer, one of the co-founders here at Wakana. And each and every Tuesday at 7 p.m., we do something special for our healthcare providers. I'm a 30-year veteran in the field of OB-GYN. I graduated from Wayne State School of Medicine in Detroit, Michigan. I completed my residency at Cook County Hospital right here in Chicago. I'm CEO of RJM Wellness and Ripped Rita Fitness. I'm a global speaker for women's health and fitness. I'm also a certified physician for the medical marijuana program, as well as the opioid exchange program here in Illinois. I'm a member of Doctors for Cannabis Regulation, and as I stated earlier, Chief Medical Officer and co-founder for Wakana for Life. So as we talk about the cannabis plant, let's first talk about our patients, right? Many of us know that we have patients that take between 5 and 20 different medications. And so as a physician, when I was introduced to CBD, when I was introduced to the cannabis plant, you know, I knew that there was an opportunity to use this plant as a holistic, organic option for patients who are looking to reduce the amount of medication they're on, or maybe even decrease and omit the traditional pharmaceutical medications that they're on in lieu of all of the side effects that we see from different medications, and really incorporating something holistic. But, you know, as physicians, we are thumbs down when it comes to cannabis, when it comes to CBD, when it comes to essential oils, when it comes to anything holistic and natural. Why? Because we're just not taught these things in medical school, you know, especially not cannabis. We're not taught about the endocannabinoid system, which you're going to learn about tonight. We didn't learn anything about really herbal medicine or essential oils, and all of these things we're going to talk about and navigate our way through this evening. Another reason why many physicians are thumbs down to cannabis and cannabis or cannabinoid products is because we don't know how they can interact with other drugs that our patients may be on. So tonight we're going to talk about drug-drug interactions. You know, is CBD a product that can inhibit or potentiate the mechanisms of many of our pharmaceutical drugs that our patients are on? We're going to talk about the pathway and how CBD is metabolized in our body tonight. So it's going to be a very informative night for our healthcare providers. And we're going to start first with looking at the plant. Let's look at the cannabis plant. I would think that many of us have heard of marijuana, right? But the cannabis plant has really two main species. One being marijuana, that's a part of the plant or the species that gets the high, the euphoria, the paranoia, the munchies, right? Marijuana is a species that has a high percentage of THC, or delta-9 tetrahydrocannabinol, and very small amounts of CBD. CBD, or cannabidiol, is what you're going to learn a lot about this evening. The other species that the cannabis plant makes is called hemp. And hemp, by definition, contains 0.3% or less of THC. So it is a species that doesn't get you high, doesn't give you the euphoria, it doesn't give you the paranoia or the munchies, because it has trace amounts of THC and large amounts of CBD, or cannabidiol. So we call the hemp species, that's a species that gives us the health without the high. And so when we speak about the plant and cannabis being mainstream, we really have to owe it to our colleague, Dr. Sanjay Gupta, because Dr. Sanjay Gupta in 2013 actually came back and gave a public apology, a national apology, that he didn't dig deep enough. You know, when we looked at the cannabis plant as being an option, as I spoke about for our patients, a holistic organic option for our patients, he said, I didn't dig deep enough. There's so much research that has been done for centuries in showing how cannabis can benefit the body. And it wasn't until 2013 when he ran into a family in Colorado. And this family has a daughter, and she just passed away, unfortunately, in 2019, secondary to complications due to COVID, who had Dravet syndrome. Dravet syndrome is a syndrome we all know, we might remember from our PEDS rotation, on kids who have a seizure disorder, where this little girl was having between 300 and 500 seizures a week. And it wasn't until her parents introduced her to CBD, this little girl went from having 300 seizures a week to 2 to 3 a week. So it was really Dr. Sanjay Gupta, his research, his travels, and his experience and testimonies that he got from thousands and thousands of patients that really has made cannabis mainstream. It's important that you also know that the FDA has approved a prescription, a synthetic CBD product called Epidiolex. And Epidiolex has been approved to treat seizures associated with Lennox-Gastaut syndrome, Dravet syndrome, like Charlotte Figi had, and tuberous sclerosis complex. So this is one of the only FDA-approved prescription CBD products. So let's focus again on the hemp species. Let's focus again on what many of our patients are requesting, and that is to use CBD for different ailments. The top 3 reasons that our patients are looking to use CBD or cannabidiol is 1 for pain, 2 for anxiety, and 3 for insomnia. Those are the top 3 reasons that our patients are looking for CBD. Now let's look at CBD, and let's look at all of the medicinal benefits that CBD can provide our patients. And there are many. In fact, there's over 20,000 peer-reviewed articles, and I'm going to show you a lot of data and research that you also can look up and find as it relates to CBD. But CBD is an antibacterial. It helps to inhibit cancer cell growth. Research has shown that CBD is neuroprotective in those patients who've had strokes or who have neuropathy or any other nerve conditions. It also helps to promote bone growth. It reduces seizures and convulsions. We talked about that as it relates to the little girl with Dravet syndrome. It also helps to reduce blood sugar levels. So when we look at CBD, CBD is a very powerful anti-inflammatory and antioxidant. And when we look at chronic illnesses that our patients face today, be it diabetes, hypertension, obesity, arthritis, autoimmune disease, the common denominator we all know is inflammation. So CBD is very, very, very important in reducing inflammation in the body to help improve these chronic conditions that our patients deal with. It also helps to relieve anxiety, pain, bacterial growth, muscle spasms. It treats psoriasis, eczema, and acne. A lot of the skin disorders that we look at in dermatology is due to what? Inflammation and bacterial infection. So CBD has a long list of medicinal properties along with the other cannabinoids that the plant makes. The other compounds that we know that the plant makes also synergizes with CBD to have a really profound effect on a cellular level. So CBG and CBC and Delta-9 and Delta-8 THC are some of the other cannabinoids that the plant makes that when combined with CBD can really help our patients in a holistic and organic way of dealing with a lot of conditions. So let's talk about how CBD and the other cannabinoids work in the body. Well, the science was discovered in the early 1990s And the science is called the human endocannabinoid system. This is a system that every single vertebrae possesses. It is a system that is one of the main regulatory systems. And what it does, it puts the body in homeostasis. It, in fact, is important in the brain, the endocrine, the immune system. It helps to modulate and regulate stress hormones, reproductive hormones. That's why we see many of our patients who use CBD and have autoimmune disease, their symptoms improve. Or if they have fertility or reproductive issues, those things improve. Why? Because this system is looking for cannabinoids to bind with the receptors to send a signal or transmit a signal either through the brain if there's fear or stress or pain, or send a signal to the immune system if there's inflammation, send a system to different pathways in the brain that regulate sleep cycles. So the science behind how CBD works and all of the other cannabinoids that the cannabis plant makes is very, very fascinating. So these receptors are found throughout the entire body, throughout the brain, the central nervous system, the lungs, the liver, the skin, the kidney, the bowel, the teeth. Yeah, even dentists are using CBD in their practice because they understand that these CB2 receptors are found in the mouth, are found in the gums, are helping to reduce inflammation, are helping to reduce bacterial infections. So what's also fascinating is that the body can produce these same sort of compounds that the plant produces. And these are called endogenous or endocannabinoids. These are cannabis-like cannabinoids that the body produces endogenously. And the two main endocannabinoids are anandamide and 2-AG. So anandamide is analogous to THC, and 2-AG is an analog to CBD. So we have two main endocannabinoids that work in the body to keep us in balance. The only problem is that when these cannabinoids that are endogenously made are deficient in our body, that's when disease occurs. That's when stress occurs. That's when imbalance in our body occurs. That's when insomnia becomes an issue. That's when all of these chronic conditions start to wreak havoc on our patient's body. So that's why every single person that we know needs CBD. The science is there. The way that CBD works in the body has been well studied. So let's look at the way that these signals are transmitted. Well, if you remember in our neurology part of your medical training, or if you're a healthcare professional, signals are typically sent from the presynaptic syndrome to the postsynaptic neuron and sent out to the body to send a signal, a neurotransmitter. Well, the reverse happens in the endocannabinoid system, where the endocannabinoids, or CBD consumed through a product, is bind to the receptors in the postsynaptic neuron. That's the receiving neuron in the endocannabinoid system. And that transmission is then sent presynaptically to different parts of the body. So it is a reverse sort of neurotransmission, but just know that this endocannabinoid system is the most vital regulatory system, that it's made up of receptors that are sending signals to almost every single organ and gland in our body. So again, this is another diagram that shows how the cannabinoids bind to either CB1, CB2 receptors, and then send signals to the immune system, to the brain, to the reproductive system, to the musculoskeletal system, to the periphery system, etc. So when we look at the data and you want to find more information, as healthcare professionals, we want to see the science and just know that a lot of data is out of Israel, because Israel has been doing studies with cannabis on humans since the 60s, since THC was discovered. But just know that PubMed is a good resource if you want to do some searching and digging, either on the THC side or the hemp side. There's lots of studies that show that cannabis can be very effective with PTSD in veterans. This is another study from the Journal of Clinical Investigation that talks about how cannabis is used in those who are receiving chemotherapy or cancer treatments to help to reduce nausea and vomiting. Other studies, again, that are being done on cancer treatment and really helping our patients who are undergoing chemotherapy and even radiation that have issues with nausea, vomiting, and improving their appetite, have found relief. Anxiety, you talk about anxiety, is a really big problem. And this is a study that showed how those who used a quick or a immediate product like inhaling CBD had great effects in reducing anxiety. There's different ways of consuming cannabis products, and one way is through inhalation, another way is through edibles like gummies. Our patients love gummies. And another way is through tinctures that are placed underneath the oil, but under the tongue. But we do know that fast-acting products are inhalation products. Difficult to treat pain. One of our hardest pain regimens that we find in our practices is neuropathic pain, the neuropathies, and how CBD has been very effective in reducing inflammation and reducing pain by using topicals as well. Topicals offer local relief for our patients who have difficult to treat pain. CBD is also being used in other areas in the healthcare industry, one being dentistry. 1 in 4 patients have a fear and phobia of seeing a dentist. And the CBD receptors, CB2 receptors that are found in the mouth, that are found with gum or periodontal disease, is fascinating. So dentists are using CBD not only for that anxiety or fear factor. That amygdala is an area in the brain that has CB2 receptors, and the amygdala is the source of fear, meaning that if you remove someone's amygdala, they wouldn't have any fear anymore. So dentists are using CBD in their practice, 15 to 30 milligrams the night before a dental procedure to reduce anxiety, and also to help with pain relief preoperatively. So hopefully by the end of this presentation, you as healthcare professionals will not be a thumbs down on this plant, but will be more open for a conversation with your patients, feeling comfortable in recommending CBD. I'm going to bring up my colleague, Dr. Joy Smith. Dr. Joy Smith is one of the lead pharmacists at Cook County Hospital. She is my business partner as well, and she's going to talk about some of the ways that we can use other holistic models in our practice with not only CBD, but with essential oils. And she's also, as a pharmacist, going to touch on drug-drug interactions and what we should be looking for when using CBD with our patients. Thank you, Joyce Smith. Take it away.
Oh, I'm sorry, I didn't have my volume on. Thank you, Dr. Rita. I'm going to turn my video on so you all can see my face. And as Dr. Rita stated, I am Dr. Joy Smith. I'm a pharmacist here in Chicago at her alma mater, the Cook County Hospital. I feel like any healthcare professional who has had to have any training in Chicago has gone through the county at least once. So very, very glad to share that experience with her, even though we didn't share at the same time. But I got my doctorate in pharmacy at Florida A&M University, graduated in 2012. And I've been in outpatient, inpatient, ambulatory, and retail settings. So I've had a little bit of experience in pharmacy, I'd say. But even though I was in pharmacy, I was in healthcare, that was like the ultimate way to help people, I still felt like I wanted to do a little bit more. And so as I noticed that the pharmaceutical industry continues to profit and profit and profit, but there are still people that are still sick, still having harmful side effects by the medications that they're taking, I wanted to get on the other side of that. I wanted to figure out some way to do that. And so initially I wasn't too sure on how to do that, but when my brother got diagnosed with cancer, I learned a little bit more about the natural way to heal and the natural way to kind of bring holistic treatments and holistic healing modalities into your life. And I decided to become an integrative nutrition health coach. That was one of the ways that I learned those things. Then my health journey kind of took me to essential oils. Very, very interested in how plant-based components and botanicals really help to heal us from a holistic perspective and from a safe perspective. And then I started to learn about cannabis. I admittedly was one of those healthcare providers who said, no, I'm not doing anything with cannabis that's going to compromise my license. But in all honesty, when Wakana found me and I was introduced to Dr. Rita and I spoke with her about the mission, the vision of Wakana, I was like, if she's not compromising her 30-year license, I'm going to be fine. And so that was kind of backwards, but then I did start to learn the literature and read the articles and start to learn about how much cannabis is impacting our health and can impact our health. So in order to further that, I became a member of the International Society of Cannabis Pharmacists. I'm also a Ruby dispensary owner at Wakana for Life because I truly believe in the healing power of cannabis. And I'm here to teach you all a little bit more. I know Dr. Rita gave so much information. But I want to just add on a little bit to it and let you all know some things about not only CBD, but essential oils as well. So Dr. Rita talked about the main reasons that people seek out CBD: pain, anxiety and depression, and insomnia. So I'll focus my articles on pain, anxiety, and depression, but it's really going to be reiterating some of the things that Dr. Rita shared with you. So, and I'll minimize this so you're able to see. So chronic pain. Well, the #1 cause of disability and disease burden globally. I mean, pain, anxiety, depression, all of these issues are really plaguing our communities and really affecting our country at large, right? So anxiety disorders are affecting 18.1% of the population every year. And it's also estimated that about 6.7 of American adults have had at least one major depressive episode in a given year. Now, we know that those numbers have probably increased due to the pandemic. And what's interesting is in the Journal of American Medical Association, they're talking about the prevalence of depression symptoms before and during the COVID-19 pandemic. And I thought that this quote was pretty interesting because any of you that may worked in underserved communities or like the county hospital, we have some communities that we service that may have low health literacy, may have low economic resources. We're seeing that the prevalence of depression symptoms in the US was more than 3-fold higher during COVID-19 compared with before the pandemic. And this is disproportionately affecting those with lower social resources, lower economic resources, greater exposure to stressors. I mean, who's not stressed right now? Kids are home with home learning, e-learning. You're working at home. Some of us are sheltering in place and working at home, so they're having to manage kids as well as their work, not being able to see your family members, not being able to interact normally. So our social skills are coming down. It's just a lot of things going on. And so that greater burden of depression symptoms is going to set in. And they've really talked about that in this article. So you can pull up the rest and read the rest if you'd like. Now, when people are talking about depression and pain and anxiety, some people are moving towards more holistic ways of healing. And so when they're moving towards those holistic ways of healing, a lot of colleagues that I've worked with, whether it's doctors or nurses, some of them have shied away from botanicals or plant-based methods of healing because they don't know what the interactions are and they're really not looking to explore those options. But the real question that you need to ask is, are there drug-drug interactions? Don't just assume. Are there drug-drug interactions between CBD and prescription medications or other plant-based healing botanicals and prescription medications? And the answer is that there can be, but there is a way to get around it so that you can enjoy the benefits of plant-based healing as well as some of the traditional medications that you may be prescribing to your patients. So we've heard about the CYP450 enzymes, and we know that they are assigned to break down most of the drugs that we take and some of the botanical preparations that we take, including CBD, including essential oils. So these are the 6 most common that break down over 50% of the medications that we're prescribing to our patients. 1A2, 2C9, 2C19, 2D6, 3A4, 3A5. And so what we know about CBD metabolism is that CBD is a substrate of the 2C19 and 3A4 enzymes, and it inhibits the 2C9, 2D6, and 3A4 enzymes. This is important because a lot of the medications that especially our people are taking for chronic diseases such as diabetes, asthma, allergy, hyperlipidemia, hypertension, a lot of those medications are metabolized through those pathways. So you may look at this and say, wait, my patients can't take CBD because CBD interacts or inhibits those pathways. But that's simply not true. So like I said, this is a list of some of the medications that are prescribed for those particular ailments. But I want you to understand that just because they are metabolized down a pathway that CBD inhibits doesn't mean that you can't suggest this holistic organic option to healing. So what needs to happen is that instead of saying, oh, my patients, let me go back one slide. Instead of saying my patients can't take this medication because CBD inhibits this pathway, what do we know about spacing out medications? We know that if we space our medications between 2 and 4 hours from another medication that's going to interact with that metabolism, then we know that we can lessen the amount of interactions and potentially avoid having them at all. So it's the same concept with CBD. If a patient needs to take CBD to assist with pain as opposed to having to take so many opioids, if a patient wants to take CBD to assist with helping them to have a sounder sleep, a deeper sleep, as opposed to having to take sleep aids or medications that can cause other side effects. Like, for instance, we know lorazepam is prescribed to deal with the anxiety that comes along with depression, but it can also worsen depression. So if we're looking for something that's not going to fix one problem to cause another, this is where CBD can come in. We know Dr. Rita talked about the many studies that talked about how it helps anxiety, how it helps depression, how it helps sleep. And there are a host of other ways that CBD can apply to our health that can really help our patients to deal with the healing without harm, deal with the healing without major side effects that are going to make them miserable. So you may be asking, who's using alternative medicine? Why should I care as a physician? I've been prescribing traditional medications forever. Why should I care? And here are the treatment trends. So when we're talking about botanicals are plant-based supplements that have a medicinal value, right? So if we're going from 2014 just to up to 2025, we're seeing that the use of botanicals is gradually increasing by the year. Now, along with other complementary and alternative medicine treatments like acupuncture, mind and body treatments, and yoga, and different other modalities that are helping people from a holistic perspective. But botanicals are really on the rise, and you can really see that in this chart here. Now, I specifically want to get into essential oils. As I mentioned, I am a certified aromatherapist as well. And essential oils were really what stole my heart and captivated me when I was first on my journey to wellness and figuring out what holistic wellness looked like. And we know that they're highly concentrated aromatic extracts that's distilled or expressed from a variety of plant material, like flowers, like grasses, leaves, roots, seeds. And they can help to improve mood. They can help relieving pain. They can help with reducing stress. I mean, the list goes on and on. You heard Dr. Rita talk about that amygdala, and that limbic system and that whole area in the brain is also affected by essential oils. So I bring this picture up, and you may be like, what is this, right? But I bring this picture up because anytime we're talking about plant-based healing, anytime we're talking about holistic treatment modalities, we need to understand that a lot of this plant-based healing goes back years and years and centuries. And And it's just important to understand that medications are kind of the new kids on the block, right? They were created way after these plant-based healing modalities that our ancestors were using for years and years. So this specifically is what doctors used to wear when they were treating patients in the bubonic plague. So the patients that were involved in the bubonic plague, it was kind of similar to how we're seeing COVID ravaging communities, right? You couldn't go into an area, we have a little bit under control now, but you couldn't go into an area where the bubonic plague was and not contract it. But there were some thieves that were able to go in and rob the graves of the people who were dying from the plague. And they just were not contracting it. They were going in, getting the riches and just remaining fine. So when they got caught, the judge said, look, if you can let me know how you got into all of these graves and didn't get any type of plague or you're not sick, let me know. And then I'll let you go free. And so what they said was, we are perfume and spice merchants. We use our knowledge of plant-based healing. And we know that these particular oils will keep us safe from viruses and these kind of things. So we put it on our face, we put it on our ears, we put it on our temples, our feet. We covered ourselves in it, right? And so that stopped us from getting the plague. Now, I'm not claiming that essential oils cure, I'm not claiming that they treat, but I do know that essential oils have healing powers, and I do know that essential oils can really address some of the issues that we're facing. So once the judge found out about that, the word was spread, and this is what the doctors used to wear. So inside of this beak that you see here, that's where they put that blend from the spice merchants. Today, and in Wakanda, the blend is called Essential Defense. In some other places, you may see it called thieves oil because of the thieves that created the blend, but it's rosemary, lemon, cinnamon, clove, and there's always one that I forget, lemon. Rosemary, lemon, cinnamon, and clove, and eucalyptus, I'm sorry. So those 5. And that blend kept them away from a lot of the disease. So you see that these essential oils are not new. They've been used for years. And I just like to emphasize that because doctors then believed in the power of plant-based healing. And I think that we do need to go back to that. All right, so we have this limbic system, right? And Dr. Rita touched on the limbic system, talked about the amygdala and its connection with fear. And I want to speak on the amygdala from the perspective of how when you inhale a fragrance, when you inhale an essential oil, what happens? So what happens when we inhale an essential oil is that the receptor cells in our nose send messages out to the olfactory bulb, right here, the olfactory neurons that you'll see in the nose. And then that passes information to that limbic system in our brain that's in charge of emotion. So the hippocampus, the amygdala, and other parts of our brain really come together to control memory, mood, emotions, and other physical responses. And that's why the smell of a good dinner or the smell of a cologne or a perfume that a loved one used to wear really triggers things into your senses and triggers things into your mind. It triggers that memory. All of those things are connected, and I think that's just phenomenal in our bodies, right? So then our bodies release chemicals that make us feel calm or relaxed or energized or uplifted, or, you know, there's a host of other emotions that can come along with just inhaling an essential oil, but our body and our brains really work together to affect that change. And that's just what happens when we inhale the essential oils. I mean, we can apply some essential oils topically that have like a menthol property, such as eucalyptus or peppermint or marjoram. Any of those type of oils, we can apply those to pain topically and really be able to address that pain. We can inhale other essential oils and really open up our lung cavities and our nasal passages if we're dealing with any sickness. I mean, the list goes on and on about how essential oils can really affect change in our bodies. But wanted to talk about what the Asian Pacific Journal of Tropical Biomedicine says. It talks about how the essential oils really get into the system and really remodulate themselves and go to the site where they're needed. They go to the site of malfunction. Now, there's various ways that the volatile molecules of the essential oils get to where they need to go, but it can provide relief, again, from ailments like depression, indigestion, headache, insomnia, on and on. And what's important, and what I want to emphasize, and what Dr. Rita tells us all the time, is that any plant-based healing modality is always going to work more efficiently when the other aspects of life are considered, other aspects of life are in balance, and diet is given consideration. So you can't expect an essential oil or CBD oil to get into your system and really affect change if it's being blocked by fried foods, processed foods, bad lifestyle, smoking, heavy drinking, all of these types of things. So you want to make sure that those lifestyle modifications, that diet, and those holistic treatments are really working together to produce wellness in your body. Now, this particular chart, on the left-hand side, you're going to see the different chemical constituents of essential oils. On the right-hand side, you'll see the essential oils that fall into those chemical constituent categories. So for instance, the aldehydes are good sedatives, anti-inflammatories, good for antiviral. And when we come over here, we'll see that lemongrass falls into that category, eucalyptus, citronella oil. So it's the same for each of these categories, but you can see that a lot of the things that we're using prescription medications for, we can use, or essential oils have some of those same actions. Do I think that essential oils need to replace each and every medication that your patients are on and you just cut them all off? Not saying that, but it could be a good complementary addition to what your patients are taking, especially if they need relief. Say your patients are on chemotherapy and they need relief from the nausea or from the vomiting. CBD can work in that way. Essential oils can work in that way by inhalation. So you see that this chart I can share with you. If I'll give my information at the end, I can share with you if you're interested. But there are a lot of healing properties in essential oils that can also be translated to how we can help our patients. So when we're talking about essential oils, just want to give a few safety considerations. Don't apply to open wounds. Keep away from the eyes and wash hands after use, because we know oil and water don't mix, but soap and water can get that oil off your hands before it gets into your eyes. If it happens to get into your eyes, you're going to take a carrier oil, whether it's almond, coconut, whatever you have around, olive oil, and just slap that on the area of your eye. Similar, if you have an irritated spot where you've applied some essential oil, you can put some carrier oil on top, and that can really begin to pull that oil from the surface so it's not causing any irritation anymore. Patch testing a small area or diluting, similar to when you're using a new lotion or a new medication that's topical. You want to patch test a small area just to make sure that it's not irritating your skin. And if it does, it'll be in an inconspicuous area where no one will see. As with CBD, as with any nutritional supplement, as with essential oils, make sure that if you're pregnant, nursing, under a doctor's care, have serious medical conditions, and our physicians can say this too, because physicians have physicians, make sure that you let your physician know that you're choosing to use an alternative modality, and your patients need to let you know that they're choosing an alternative modality in addition to their medications. The way that you can advise them is to space these alternative modalities 2 to 3 hours out between their traditional medications and essential oils, or traditional medications and CBD. This way, the interactions that we talked about with that CYP450 enzyme system won't be that big of a concern, because we've already made sure that we spaced out that metabolism. With both CBD and essential oils, more is not better. Plant-based molecules and plant-based constituents are so powerful and so concentrated that you only need a little bit to affect a lot of change. When we're talking about essential oils, you want to make sure that you just diffuse up to 30 minutes at a time. We don't want to overwhelm our senses. So if you are going to be diffusing longer, maybe step out of the room after the 30-minute time. Or you can have a diffuser that has an intermittent setting. Whatever it is that you decide to do, just make sure that you are abiding by the safety considerations, and make sure that your patients, and you're always transparent with your patients, make sure that they're transparent with you, and you try to open up your mind to the natural modalities of healing, because there really is help and healing there. So Dr. Rita, Dr. Erica, thank you so much. I think I saw, was it Dr. Peoples on here? Thank you so much for your time, everyone. I look forward to talking with you all soon. And if there are any questions, I will put my email in the chat.
Thank you so much, Dr. Joy Smith. We're going to bring up Dr. Erica Montgomery. She's a clinical psychologist, one of our Wakana medical advisory board members. Just like you to come up and talk to our colleagues about why it was so important that you were able to learn about CBD and really offer CBD as an alternative for your patients.
Yeah, thank you so much. I love the information. Every time I am on, I learn so much more about CBD and just the benefits, the overall health benefits for both physical and mental health. And then the essential oils is just an extra plus. Dr. Joy just does such an excellent job sharing all of the ancient science, really, that we really need and are bringing back. And so I'm a psychologist. I have been doing mental health for 23 years. And I started to really notice that my patients, because of the psychotropic medications they were taking, instead of really helping and healing them, they were having other problems and other side effects. And so I knew that the cannabis plant was a healthy alternative, but I didn't know exactly how it would happen. I was thinking more of the medicinal marijuana, but then I came upon CBD, and it really was the game changer, because a lot of my patients are high functioning. They go to work every day. They cannot function and be high. They, have very high demand and high stressful jobs. And so CBD was that perfect alternative, because it allowed them the relief from the stress, from the anxiety, from the insomnia, the depression, the focus, and they didn't have to worry about getting high. They didn't have to worry about not passing drug tests. And it was I was able to educate them enough to be open to giving it a try. And now it's a no-brainer. It's a no-brainer. And I tell, all of my patients, anyone who will listen, I'm a daily user of CBD. I love the power gummies. I love the pure tincture and the 500 milligram hempranium. Because of what I do, particularly during this quarantine, I've gone from seeing patients 50% to almost 80%, because it's such a demand right now. And the first thing I educate my patients on is CBD, because most of them don't know, and they still think it's medicinal marijuana or recreational marijuana. And so I just have to say I love CBD, and I love what it does for my patients. And we need it. We really need it for overall physical and mental health, because once we're calm and our bodies are back in balance, then we can really tackle why we have the anxiety, why we're dealing with the depression, why we're so easily stressed. And so thank you.
Thank you, Dr. Montgomery. Thank you so much. I definitely agree with you, because once the CBD is introduced into the system, it can kind of help quiet that noise and help your patients and so many other people's patients to cope. So definitely understand and definitely agree. We have a couple of our medical advisory members on. I see Dr. Peoples, Erica Zachary. I see Kathy Weathersby on here. Dr. Rita had to step away for just a moment. So if any of you all want to share your stories as to how CBD has helped you in your everyday life or in your practice, we are open to hear. We have about 15 more minutes until the next call. So if any of you all want to step ahead, we are welcoming you now. Let's see.
Okay. This is Dr. Peoples, and I kind of like Dr. Crystal, as a matter of fact. I think I like that a little better.
Not a problem. Dr. Crystal, gotcha.
I have two testimonies this past week. I had some family over for a family event. We were safe, mind you. But as a relative was headed out the door, I said, why don't you try these? And I didn't know if he had any medical issues or not. I said, why don't you just try these pure gummies? And I got a call 2 days later. He said he tried the gummies, and little did I know that he was having problems with his knee. And he started taking the pure gummies, and instead of going for the cortisone injection that he was scheduled for, he said he got on the website and ordered him some pure gummies and said he loves them. they took away the pain in his knee, and he will not be going for his cortisone injection.
Wow.
I have another relative who had been suffering with neuropathy type symptoms in their legs and feet, and started taking the tincture, the Power Hempranium tincture. And she didn't do so well with the 3 drops after a couple weeks. So I told her to increase it to 8 drops, and her neuropathy is gone. So I have another customer who's ordering Power Hempranium for her neurologic symptoms in her feet. So my why is I'd rather do plant-based healthy than pharmaceutical derivatives that have all these potential more serious side effects than the CBD.
That is awesome. And I share in that feeling with you. I'm a pharmacist and I feel that way. So I definitely feel like medications can be life-saving. I definitely know that there are patients who need them. And I definitely know that there are patients who use their traditional medications alongside holistic alternatives. But I am really excited to hear that there are healthcare professionals, especially like you, Dr. Crystal, Dr. Montgomery, Erica Zachary. There are so many people who value the plant-based healing alternative and are willing to express that to their patients, their family, and even use it for themselves. I personally am a great CBD advocate and essential oil advocate, as you saw. And I love, like what I told Dr. Erica, I feel like it quiets the noise. I'm one of those people that deals with anxiety. I think we have all had some depressive symptoms at some point, whether it was during the pandemic, before the pandemic, or otherwise. And I think it's just a great alternative that won't have you in the bed for hours and hours on end, that won't have you drowsy and dealing with other side effects, but it really is working to bring your body back in balance while addressing those symptoms. So Dr. Crystal, I definitely agree with you. Do we have any questions or any other medical advisory board members that would like to speak? If you do have any questions, you can feel free to put them in the chat. If there's any medical advisory board members that would like to speak, feel free to come off mute and go ahead and share with us your information about how CBD has affected you or your patients. Okay, let's see if there are any questions here. I don't see a question, but I do see some comments. Loving the story about increasing the dose instead of the person abandoning the CBD. Taking the gummies and the Power 500 since mid-December, and you've not taken any Advil or pain meds since. Back and knee pain is so much better, and you can get up and move without pain. Amazing, Evelyn. And we have a friend who has questions on how CBD can help with perimenopausal symptoms, especially hot flashes. So in short, the perimenopausal symptoms or the hot flashes come as a result, and you all can chime in if you'd like, as a result of some hormonal imbalance. And Dr. Rita is really a whiz at these questions. But CBD works to bring your body back into balance. So those hormones that are out of balance, those hot flashes that are coming as a result of that hormonal imbalance can really be balanced out by the use of CBD. So I'm gonna give you our email address, so that if there are any specific questions about perimenopausal and hot flashes, that we can address those via email. You can send this to me and I will send it back over to Dr. Rita, or I'll give you Dr. Rita's email address as well. And I believe that I have a clip somewhere where we had one of our medical advisory board members talking about how it impacted her in regards to her menopause. So we'll make sure that we get back with your friend Magali. If you either, it's Rita MD, I'm sorry. If you email ritamd@wakana.com, or you can email me and I'll forward the question to her. We'll make sure that we get that question answered. Any other questions or comments? We are so glad that you all were able to come out. Make sure you invite your healthcare provider. Make sure that you continue to come and learn with us. And if anyone is interested in learning more about our products that you heard Dr. Crystal talk about, that you heard myself and Dr. Erica talk about, you can come over to the 8 o'clock call, get back with the person that invited you, and they can give you the login information. But you can come over to the 8 o'clock call and learn more about our products, learn more about how you can make your footprint in the cannabis industry through opportunity. And if I don't see any more questions, I think we can adjourn for the evening. You all have a great evening, and let me see. I don't think I can end the call for everyone, but you all have a great evening. And again, if there are any questions, either get back with the person that invited you, or you can feel free to email Dr. Rita or myself. So thank you so much, Medical Advisory Board. You all have been awesome, and we look forward to seeing you soon. Thank you all, everyone in the crowd, all our physicians, our doctors, our healthcare professionals, our guests, our business partners. We appreciate you.
Excellent. Thank you so much, Dr. Joy.
Not a problem. Good evening, everyone.